Hello, I am Dr. Deepak Garg. Today we will discuss about a journal club topic, that is overview of control measures for prevention of surgical site infection in adults. So our main focus will be what measures should we take to prevent infection pre-operatively in elective orthopedic cases where we are going to use implant. So if we talk about the definition of surgical site infection, so the surgical site infection in cases where we use implants, so the infection within 90 days of surgery is considered as surgical site infection if we are using implant in the surgery. So to prevent the surgical site infection, what are the pre-operative measures that we should take? So number one is, if the patient is a smoker, we should try cessation, smoking cessation 3 months prior to surgery. That has a significant impact on post-operative complications. Number two, we should be able to control the comorbid conditions like diabetes before the surgical planning. Then let's divide it into where after the patient admission and before the patient admission. So before the patient admission, we can give mupirocin ointment for applying in the nasal mucosa, and we should apply it for 5 days before surgery. So this is one option, and alternative to this option is we can give povidone iodine only applied day before surgery in the night time and in the morning 1 hour before surgery. So only twice application of povidone iodine to prevent the staph aureus and MRSA in the nasal mucosa. That the data says that there is a significant reduction in infection if we apply the povidone iodine or ointment mupirocin before surgery. So specifically talking about arthroplasties like knee arthroplasty or hip arthroplasty, we should definitely use these protocols, and we should try applying povidone iodine night and in the morning time before surgery. Another thing is a bath, that is a chlorhexidine bath. So 4% chlorhexidine solution can be used for taking a bath, normal bath with the water, where the solution like we use a shower gel, we can use the 4% chlorhexidine, and we use the chlorhexidine solution over the entire body, and we start from the neck until the toes. We will apply the solution, we keep the solution applied for 2 minutes, and then we wash it with a water, and then we use a clean normal towel, and this we should do on the morning of the surgery. So this again data shows that if we give up 4% chlorhexidine bath before surgery, that has a significant reduction in the infection rate post surgery. We can use this in all cases of total knee replacement patients or arthroplasty cases. So the another thing is, before surgery that we want to talk about is in the intraoperative room. So let's talk about saving. So the hair removal should be done only if it is required. If there are very limited or no hairs in the surgical field, then we should not do the hair clipping. And if you think that the hair removal is necessary, then that should be done in the operating room itself before the surgery, and its saver should not be used for removing the hairs. We should use the clippers, and that should be electrical clippers where head can be changed, and the disposable removable head should be used for every patient, and this is the way where we should remove the hairs. So after we remove the hair, so another thing that we should keep in mind is the traffic in the operating room. So we should keep the doors of the operating room closed, and we should allow as minimum people to come out or go out in the operating room as possible. Only the necessary people should come inside the OT. Rest other time the OT room should be kept closed. And proper use of the mask, proper use of the cap, and proper use of the shoe cover. Shoe cover is usually we miss it. We should always use a proper shoe cover for every person in the OT room. And the OT should be clean. We should use a laminar airflow environment in the OT. It should be a modular OT with a laminar airflow. Then for the pre-operative antibiotics, we should give pre-operative antibiotics to every patient. That has a very significant role in the reduction of the infection, and it should be given approximately half an hour before the incision. And then we should do a proper scrubbing and painting painting should be done with a chlorhexidine solution or betadine, povidone iodine solution or alcohol based solution. So there is no significant difference in either of the three. We can safely use povidone iodine or chlorhexidine or alcohol based solution for painting, and then proper sterile drape should be done. That is a most important aspect of it. We should use a disposable drapes and gowns, and we should do a proper draping. So this is how we can reduce the infection rate in the elective orthopedic cases, and we should follow these protocols in each and every patient. So this was about today's paper, and I will put the description link of the paper article in the description. So thank you guys, thank you very much.